Shockwave therapy is a new non-invasive solution for chronic musculoskeletal pain. The extracorporeal shockwave therapy is frequently used in physiotherapy, orthopedics and sports medicine. Applications are mostly associated with the treatment of chronic muscular and tendon disorders, back and cervical pain. Most common indications include painful shoulder, epicondylitis, low back pain, Achilles tendon pain, tendinitis and trigger points. During the therapy, a high-intensity acoustic wave interacts with the tissues of the body. This leads to a cascade of beneficial effects including neovascularization, reversal of chronic inflammation, stimulation of collagen production and dissolution of calcium buildup. Stimulation of these biological mechanisms creates an optimal healing environment. As the injured area is returned to normal, functionality is restored and pain is relieved. What is extracorporeal shockwave therapy and how does it work? In extracorporeal shockwave therapy (ESWT), a series of acoustic shockwaves is given to the area where you are having symptoms. These waves are mechanical, not electrical. They make the area inflamed, which speeds up your body's healing process by increasing blood circulation and metabolism. It may also give you some pain relief straight away or for some people a bit later. Shockwave therapy can be used to help with heel pain, plantar fasciopathy, Achilles tendon pain, Achilles tendinopathy, tennis elbow, lateral epicondylgia, calcium buildup in tendons, calcific tendinopathy, pain in the tendon below the kneecap, patellar tendinopathy. Why should I have ESWT? The treatment should help reduce your pain so you can go back to your normal activities and carry out your exercises and rehabilitation more easily. What are the risks? Complications do not normally happen with shockwave therapy. It is low risk but is not always successful. It can cause increased pain and sensitivity, which normally gets better with time. People who have poor sensation, neuropathy, or hypersensitivity at the proposed treatment site should not have ESWT. When should I not have ESWT and when do I need to be careful about treatment? ESWT is not allowed if you are pregnant, have had a steroid injection to the same area in the last 3 months, have an infection, wound or tissue problems at the proposed treatment site, are under 18, have poor sensation, neuropathy, or hypersensitivity in the target area. You must tell the clinician if you have a cardiac pacemaker, are taking any anticoagulant, blood thinning medication, are taking any anti-inflammatory medication. Are there any alternatives? Tendon problems can also be treated through physiotherapy with exercise, activity modification, footwear or splints. How can I prepare for ESWT? Make sure you wear good supportive footwear and continue to follow the advice given by your clinician. You should stop taking non-steroidal anti-inflammatory drugs such as aspirin 24 hours before ESWT treatment. Asking for your consent. It is important that you are involved in decisions about your care and you are required to sign a consent form to indicate that you agree to have the treatment and understand what it involves. You can change your mind at any time, even if you have signed the consent form. What does the treatment involve? Each treatment takes between 5 and 10 minutes. The painful area is located through palpation and gel is applied to improve the transmission of the shockwaves. Treatment is then delivered through a handheld device attached to a shockwave machine. Will I feel any pain? The treatment can be painful, but if the pain gets too much, the settings can be adjusted to reduce it. You may also have a mild ache after the treatment which should pass after a day. What should I do after treatment? You can carry on with your usual activities but avoid any exercise which feels painful for 2 days, 48 hours after treatment. Don't put ice on the treated area or take any non-steroidal anti-inflammatory medication, such as aspirin, ibuprofen or diclofenac, as this will stop the inflammatory and healing processes. The shockwave treatment has started. You may feel pain relief from the treatment straight away but long-term effects are normally felt after 3 months. You will have a follow-up appointment in clinic 3 months after your treatment. Shockwave therapy may work better when combined with exercise. If you have been prescribed exercises and stretches, please continue with these.